Welcome everybody to the final and fifth extra bonus week of SLEEPtember 2020. We were lucky enough to have four of our returning guests coming back to us to join us today. Whoa, talking into my phone. Sorry about that, everybody. Welcome to SLEEPtember 2020, and we are lucky enough to have Dr. Alicia Chung, Dr. Azizi Seixas from the NYU Langone School of Health, Kevin Bradley, an RN and transplant coordinator, and who's also one of our Awake community educators up in Toronto. Eugena Brooks, who's the ASA blog writer and has done an amazing job covering all four of the previous shows of this SLEEPtember and writing about it. And we thought this would be a great time in the middle of the COVID era to sort of recap what we've learned in SLEEPtember regarding all the comorbidities and how it's mostly affecting our vulnerable populations as a result of COVID. We're seeing those issues now more than ever. With that being said, I'd like to check in with everyone. Dr. Chung, I'd love to start with you and just see where things are at as far as with COVID in the greater New York area. We've heard rumors or noise that there's a spike and an increase right now. Is that due to fatigue? Is the telehealth component helping? Those type of things are sort of where I'd like to get just a pulse on where we're at today for our community, if you don't mind.
Thank you, Adam, for that introduction and for having me on today's panel. I'm very excited to be a part of our discussion. And yes, as we all know, that the pandemic actually originated here in New York City back in March, and with the vigilance of our governor, we've been successful in reining in those numbers, and it's allowed us to engage and interact as close to normal as we can expect in the summer months. More recently, we are hearing, unfortunately, a spike in numbers, and quite a few of them are from schools, daycares that are opening and then having to close shortly after with outbreaks. And the health guidelines require that they close for a minimum of 24 hours for deep cleaning and disinfecting. So with the start and stop of a lot of schools, there's a lot of hiccups around that, particularly given the density of our population and the diversity of the populations that we have to manage in a major metropolis. So I think that with the change in temperature that we're recognizing, and there is this harsh reality of the potential for a second wave. So we aren't as dire in numbers as we were rising back in March. I think we've learned, and we have protocols in place to ensure that we never reach those astronomical levels as before, but we are very much vigilant on the matter.
I appreciate hearing that straight from you guys, and I know you guys see it every day and on the ground with your community and your different boroughs that you guys are servicing. Dr. Seixas, I'd love to come to you as far as maybe elaborate on that as far as how the telehealth component and the fact that you guys are the trusted messengers, and we are striving as the patient community to be the trusted messenger in this time of misinformation and fake news and all this other stuff. Because as Dr. Chung said, we have the fall and the winter temperatures coming. So there's always been the hypothesis of what will the flu do this year. I've heard from other professionals it might not be as bad a flu because the travel has been down so much. I'm just sort of wanted to get a check in with you and just sort of see where we're at the end of this month, because literally it's been a year since we as the ASA had our last in-person SLEEPtember meeting that we had at Presidio. And it's amazing how far we've all come in a year. This is, we're all living in this virtual world now. So it's the new normal, it's the broken record, as we all said. So take it away.
Sure. Thank you so much, Adam, for having me. This is, has been an incredible month of wonderful activities that are all geared at improving literacy and information about sleep and its consequences. And particularly, I really thank you for the opportunity to discuss So with regard, we've seen, and this has been well evidenced in data that has been published both at as well as other places, where low income as well as racial ethnic minorities are less likely to actually adopt or to have significant uptake of telemedicine and telehealth. That doesn't necessarily mean that they are averse to the idea of participating in telehealth or telemedicine applications or solutions. But what it means is that there needs to be greater levels of outreach in engaging communities that don't typically use these more unconventional strategies of engaging with their healthcare provider. So in terms of what we're seeing, and I can share with you what we are doing at New York University, as well as I know some of my other colleagues at other institutions, that in many ways we are gearing up for a potential second wave of COVID in the metropolitan area. And we have seen certain pockets of cases where we've seen spikes. And as my colleague, Dr. Chung, mentioned, that could be due to some lapses in adherence to the public health strategies and guidelines outlined both at the federal level as well as at the state and local municipality level. However, we do recognize that with the confluence of flu, where we're emerging and just creeping into the flu season, that coupled with potential spikes in COVID may actually present several unique cases, such as we may have cases where we'll have a spike in flu, particularly among vulnerable populations, which would be children as well as the elderly. And then they too might be more at risk for COVID infections. And as a result, particularly for the elderly, might be more prone to increased levels of mortality. So we have to be able to balance how it is that we manage both the flu as well as COVID. In addition to this, and this is where the research needs to get ahead of this particular pandemic, is there a possibility that someone could have both the flu and COVID at the same time? And that's quite an unfortunate scenario, but it's one that we are all grappling with, and we need to be able to figure out strategies in which we can know how to best treat those individuals who may present with both flu as well as COVID cases. How does that impact low income and racial ethnic minorities? Well, we know this, and this has been evidenced in the New York state and city data, that racial ethnic minorities were disproportionately burdened by COVID infections as well as COVID deaths compared to their white counterparts. So Black and brown folks were more likely, and it's because primarily the jobs that they have are primarily on the front lines, which puts them at greater risk in order to contract COVID. And so those are some of the things that we're thinking about. We're trying to do heavy surveillance, and we're also trying to prep to find ways in which we can create management strategies to take care of individuals with flu and COVID, and potentially those people who may have COVID and flu, and trying to see how we can do a better job with ensuring people adhere to public health recommendations.
Let me see if I could unwrap that a little bit. And I haven't really thought about it, not only the double combo of having COVID and flu, but then we now have this third element that you're seeing being talked about in public health and in the media, and that's, should I go get a vaccine? Or if I'm a person of color, I don't want to get that vaccine. I don't want to be the experimented person. And so I wanted to use this sort of segue to go to Kevin, who's in Toronto, and who used to work in the California National Transplant Team, but is also now doing some of the same work in Toronto in the Canadian healthcare system. And just prepping for this call today, I asked Kevin, I go, it never occurred to me, but when you're looking at donors and recipients, what is the breakdown for people of color and white people, and how does that go right now? Because there's got to be a lot of people that are right now are going to be in need of a lot of transplants because of the long-term damage that we're doing with the COVID. So Kevin, if you don't mind, sort of just telling us, from your expertise, what you're seeing on the ground in Toronto, and take it away.
And you're right, Adam. When we talked about this earlier, you're right. I mean, we did have some outbreaks here in primarily our, long-term care facilities, but there was also quite a lot of breakouts in the dialysis units where people are, have chronic disease, chronic kidney disease. They're coming 3 or 4 days a week for dialysis, and a lot of those units had, a few outbreaks. Regarding the, what we were talking about earlier on, the socioeconomic impact in this, certainly we are seeing a lot of people that, as you said earlier on, that are affected with this, but in the lower socioeconomic groups. There's a big Asian mix here. There's also the African American communities that were harder hit. And was talked about earlier on, these people are on the frontline jobs, and some people are in jobs that there was no real safety measures put into place initially. So that's where we were seeing our spikes. Just to give you an update on what's happening here in Ontario, our numbers were really about a month ago below 100 positive cases a day. Then when things started easing up a little bit, we went to about the 200 or 300 mark per day as schools opened up. Now, yesterday's numbers were actually, over the weekend, were 400, and now we're at 700 per day in Ontario. So when we talk about a second wave, we really are in the second wave, and we're preparing for this now and looking at some measures to try and prevent all that spread within the community.
So are do they think up in north of the border from us that this is just this second wave is really more a result of the fatigue and the confinement, that everyone was locked in this summer and they got out for Labor Day, and we're going back a couple of weeks now. I live in Florida, so everybody's got COVID here.
Yeah, I think we talked about before in another segment, or we've talked about privately as well, the most people that we're seeing are under 30-year-olds, right? And during the summer months here, a lot of people go to cottages, they go camping, they're out doing recreational stuff in groups. And as much as a lot of those people we were seeing in our COVID assessment centers that were coming for tests prior to their trip, these people then were coming back after being in social gatherings, in bars or clubs or even camping, whitewater rafting together, for example. And they were the people that were primarily coming back positive.
So I'd like to use that opportunity as a segue to talk to Eugenia, who's one of our patient. One has chronic comorbidities that she's managing along with AFib and COPD, but primarily apnea. And she's on the ground and just prepping for this call today. And, I talk to Eugenia once a week about what's going on for our blog and what's going on in our social media wake groups. And she said, there's I've lost people where I live, and, it's getting scary again. And, people are just locking themselves in, and there's rushes on the grocery stores again. The panic is starting to come because the winter months are knocking at our door. So Eugenia, I just wanted to check in with you and see how you're doing and sort of get a feel for where your head's at these days.
Well, thank you, Adam. I'm just doing what I do, which is stay out of the way and keep an eye on the pulse of things. It is what it is. It's not an easy situation, but I understand what I'm up against, and I do what I need to do to preserve my health. And, it's difficult. My neighbors are struggling with this new reality. This is a building with both mental and physical disabilities. And, some people are really struggling because they don't understand. They don't get, the word pandemic. They don't get what they need to do. They just feel restricted. And it's just scary all the way around. Those who do get it, it's hard. Something as simple as yesterday, they had the guys who, to take care of the grounds. they came in and there was a mishap and the van caught on fire. And I mean, the fire department came and put it out. And, before all of this, it would have been a little exciting for a moment or two, and then it would have been all over. But now with everything that's going on, it created a lot of mental stress for people. It hit them harder. Okay, oh my God, what's going on? It, it, with everything else that's going on, it just created even more stress and made it more difficult for them to deal with. And, from day to day. So now every time you hear the sirens outside, the people inside are upset and they go running to see if there's something wrong in the building or whatever have you. It's just difficult. It's a difficult situation.
Let me ask you a question, Eugenia, because I know Dr. Chung said and Dr. Seixas said both said the fall's coming. What are you doing to get your flu shot? Does that come to you, or do you now need to go out and get that?
Well, that's the thing. Okay, nobody wants me out, and I certainly don't want to go out. They're trying to. I find it interesting, okay, because allegedly we should already have these types of services in play. But now that we are on the spot for utilizing them, we're finding out not so much. I'm waiting to hear they're supposed to be making some sort of arrangements to have someone come in and give me the flu shot.
So that's a great segue for Dr. Chung and Dr. Seixas. If one of you guys want to take it, and maybe you can shed some light on what you're advising patients in your communities to do right now, as far as getting access to this stuff. Either one of you want to take it away?
I don't think they know what to do with
Chung
that.
go ahead first, please.
Go ahead, Dr. Chung.
Thank you. Yes, we're highly encouraging people to obtain their flu shot this year now more than ever for obvious reasons. And we leverage the close proximity of some of our retail pharmacies and try and promote the accessibility of those outlets as options beyond going to hospitals where they could endanger themselves further to be exposed to additional pathogens if they were to go to the hospital clinic setting. And as well as constantly wearing the mask outdoors, that's obviously at the fore.
Crucial.
Extremely so. In terms of the home-based care, especially for those who had disabilities and limited mobility options, there are some home-based medical centers, medical care options that I know of where regions are able to send home nurses and home health aides to provide the flu vaccines to the patients who are unable to get out on their own. But one push in particular is that we're encouraging people to get it earlier rather than later while we still have fairly mild weather. And people don't feel as restricted because of the cold weather and are still able to be mobile. So we're highly encouraging people to obtain their flu shot earlier rather than later in the season.
Is it a historical trusted messenger issue as well with the Black community and the Latino community as far as whether they should get the flu shot before COVID ever even came on the scene? I'll ask. I guess let's go to Dr. Seixas with that answer.
Sure. I mean, I think that's a fantastic question. And there's no denying that our communities, particularly communities that have been historically disenfranchised by the healthcare system, are more skeptical about engaging with their healthcare provider and healthcare systems, particularly anything that relates to vaccine of any sorts. And so, yes, it really would take a trusted healthcare messenger. Doesn't necessarily have to be someone who is healthcare per se. So many of the communities that we work with, so there's one particular church in Brooklyn, New York that we partner with, where they have repurposed their building and their facility to host, health fairs as well as opportunities where vaccines can be administered. Why is that important? Well, it is important for several reasons because places like churches and faith-based organizations still serve as the last vestiges of trust in our country. Typically, our federal government, as well as the federal agencies tasked with taking care of our public health, such as the CDC, FDA, have become politicized, unfortunately. And as such, places like churches, faith-based organizations are the final place where people feel some level of trust. But let me just share a little bit in terms of what can be done. My colleague, Dr. Chung, provided some really, fantastic first steps as to what people ought to do. However, there are other solutions where we're, particularly myself and Dr. Chung and others in the space of digital health, we're not just trying to focus on ensuring that people receive vaccines, but we want to ensure that if people feel that they might have contracted COVID, that they might be able to monitor themselves remotely and perhaps do some form of remote management whereby those data can be streamed into healthcare systems so that healthcare systems can monitor them remotely, as opposed to having them go out into the open, putting themselves at greater risk as well as others at greater risk. And so what we're finding is that telehealth and telemedicine approaches and solutions do not just focus on having some level of engagement with providers whereby you have some consultation, but it may also be tracking of information, such as tracking your pulse oxygen levels, tracking your respiratory condition and health, tracking other clinical vital signs. All of that can be monitored remotely through some form of telemedicine and telehealth. And, I'm not trying to advertise NYU, but I know we have been tremendous leaders in this regard, as well as other, locations and facilities, as well as some of our large, large stores such as Sam's Club. I just saw Sam's Club just release their telehealth system where people can pay, I think, $10 or so a month to be part of that, and that includes some form of telemedicine and remote access as well. So there are several different potential solutions where people can, one, get vaccines, but also get monitored, not just for COVID, but also the other chronic health conditions that might be managing at this point in time.
I think that's a wild sort of combining of all the different fields of streams. So we had the telehealth component, you had the trusted messenger, you had the in-person churches and barbershops. And then you have someone like Eugenia, where maybe it's maybe getting access to these mobile apps, or even having a cell phone, or having a personal computer or a laptop or some sort. And I love the idea of keeping the pressure off the healthcare system and leaving the people that come through that emergency door for the severe patients that need to be there, need to be hospitalized, and need to be potentially ventilated or whatever other treatment interventions that you great healthcare professionals are learning how to manage this chronic disease until we have long-term solutions. Dr. Seixas, you opened up my favorite Pandora's box, but I'd like to maybe, if you could help me, sort of set the record straight just on something as simple as the pulse oximeter. Is it true or is it not that it's harder to get readings on people of color because of physics, because of the darker your pigmentation is, it's harder to shine a light through our skin?
So I think the traditional pulse oximetry devices traditionally have had some issues with regards to rendering accurate and valid and sensitive readings.
Right.
So those technologies have evolved, particularly as the sensing hardware has evolved and has gotten better. There are different forms, right?
Right.
$20 pulse ox be different from your $150 pulse ox? I mean, because it may do some other things. And so yes, many of the algorithms that were developed, unfortunately, in traditional and old models, had poor sensitivity and reliability as it related to population health, meaning being able to capture data for a whole host of diverse communities. So you are absolutely correct. However, this is why we try our best to do multiple readings and we track people over a longer period of time, so that if there are any what we call outlier type of readings, we might be able to monitor the person continuously to see if there are significant trends. But I agree with you that there are some issues with regards to hardware sensing data. But by and large, some of these and most of these newer technologies are trustworthy and are reliable.
And I got to say that's nice to hear, because we at the ASA launched our pilot sleep health study with the Apple Watch 4 years ago, and we were hoping for pulse oximeter, and we knew it would be successful. And we're happy that Google bought Fitbit, and they sort of set the precedent for the pulse oximeter that came out in their consumer device. But I always tell people, we don't know what we don't know yet. So if you really want to do your pulse ox, get a medical grade pulse oximeter, and that way we know what's really going on. So that was sort of been my advice to this point, but I'm happy to hear, that you're seeing with multiple different readings and bench testing that these consumer devices are getting close enough that the outliers are fewer and far between, and that this could be a great sort of funnel into the healthcare system, so we know who to send and who not to send with this passive data that we're wearing at home and collecting instead of the 5 minutes in a doctor's office. Which brings me to another point, Dr. Chung, that I sort of, you and Dr. Seixas and Dr. Grander and Dr. Giardine John Louis behind me wrote about, that you presented at this past sleep meeting, and that, that's talking about sort of the elephant in the room, and that, in the cardiovascular world, they asked 7 questions about your health. And guess what? The 8th missing question is missing. It's our sleep. And that should tell everybody who's listening, on the public, the professionals, the laymen's, is that, until we make sleep a full component of all healthcare system, we do not have the whole story. We do not think that everybody's got sleep apnea. We just know that until you manage that sleep, you cannot manage, as we talked about earlier with Lisa Graham earlier this month, diabetes, or with Dr. Thomas at Beth Israel about managing the hypertension, or even handling any of the mental health issues that we talked about with Dr. Grander. If the sleep's not under control, you can't manage any of this. And then if you're in a vulnerable population, it's stacked against you. I mean, so Eugenia, you sort of want to comment on that as far as what your experience?
You just laid out my whole life, basically, because looking back on it now, I realized that before there was anything else, okay, there was sleep apnea. And, it's in my lifetime, they had no idea to look for this in me, because during my life, they went from believing that it was an older man's disease to realizing that it crosses gender boundaries, it crosses it crosses age boundaries, okay? And because of that situation, I had it. It did its damage, enormous amounts of damage, okay? And by the time that I got a handle on the sleep apnea, I already had developed AFib. I already had osteoarthritis inflame into rheumatoid arthritis. I already had worsening bronchitis become COPD. Now I have all of these things working against me.
it was interesting in preparing for this month and looking for our special guest expert doctors and experts in all these different co-occurring areas, Eugenia, that finding a diabetes doctor with a sleep background was few and far between, and it never really occurred to me until I went looking for it. And Dr. Parthasarathi, who we work with, who's on our cross-disciplinary advisory board, who we have an ongoing PCORI Awake Peer Mentors program with, who we're going to bring this education towards and get it out to our patients about what's going on with flu and what's going on with COVID and how to manage all this. He said, he goes, by the time you get diabetes, you're not reversing it with the sleep apnea. You might be able to manage it, but you're not going to undo it. And that to me really, really blew me away, because that's a whole nother field, just like the cardiovascular pathway. That, wow. I mean, you're talking about missing the canary in the coal mine. It's sitting there. Whether you have apnea or not, there's a sleep component to why your blood sugar might be out of whack, so to speak. So, Kevin, I'd love for you to come in and sort of talk about, some of the patients that you're seeing before COVID and now after, as far as what is it like to try to get people to donate organs of color, and who are the recipients? Is there a longer line for that stuff?
Yeah, I'd like to discuss that, but I did write a note, Adam, earlier on, and I don't want to forget this. There's a website that I go and get a lot of my research from, and they're actually really good at, they want to have people send in those in the front line that have died during COVID, and to date there's over 120,000 worldwide. So I put that out there for all the frontline workers. That's doctors, nurses, our cleaners, our people that work in the cafeterias, everybody that's in a hospital, or paramedics, respiratory therapists. There's almost 120,000 worldwide. So I just wanted to acknowledge that before I go on.
And just so I'm clear,
yes,
hold on, Kevin. Just so I'm clear, is those 120,000, you are able to accept organs from those donors, right? Even though they have COVID?
No. Sorry. I digressed. Before I wanted to talk about organ donors, I was talking about people that were working on the front line that actually had passed away due to COVID. Okay, so this website's actually tracking that, and they want people to send in loved ones, so they can track and continually follow the numbers. And again, it's Medscape Transplantation, and to date there's been about almost 120,000 worldwide.
Wow! So we've lost 120,000. We've lost 120,000 frontline healthcare workers around the world from the first wave of COVID, and we now know that the world is about to see a second spike. Yeah.
I think I read in the UK there was 6,000 almost. I may be remiss in that, but it's sobering in detail to follow. It's really a wake-up call. And when we talk about COVID fatigue as well, sometimes people we're all tired of it. We really are, but we can't let our guard down. Especially in healthcare, and especially when we're offering patients alternatives, like we talked about, telemedicine, and not coming to facilities and going to your churches and all these outreach communities that are facilities that have, vaccinations for people to do are really wonderful. And we're seeing a shift in healthcare, of course. But to answer your original question, yes, it was very almost really soul destroying at the start, when we were looking at maybe April, May time, when, unfortunately people do pass away, and some people pass away with aneurysms, or, everybody out there thinks that most donors come from motorcycle accidents, and that's not the case. But certainly we had pedestrians hit by cars or motorcycle accidents. And the majority of people were under, for example, the age of 40. And it was really awful that a family did decide to donate their loved one's organs, and no organs were placed. No organs were transplanted. And despite the family either wanting to honor their loved one's wish to be an organ donor, or just thought that it was the best thing to do. And after making multiple offers out there to our transplant facilities, no organs were accepted. So that was really, really hard.
So I guess I'd like to come back to Dr. Seixas, and and just for me, and you know, I know what I don't know, and I know the little bit that I do know, which is dangerous. Amongst people in the Black community and the Latino community, are they scared to register to give organs? Just like the issue with vaccines and the trust issue, this all, I imagine, works hand in hand with each other.
Yeah, sure. So actually, my very dear colleague, Dr. Stephen Wall, he has led several NIH federal agency studies looking at organ donation, and it has been, you know, quite a challenge for him and his team to enlist folks, and not just from underserved communities, but communities in general, right, as to how is it that they might be able to provide organ donations. And I think in many ways, it's both a scientific question, but I think also too, you know, a cultural question, and potentially, not to get philosophical, an existential question, right? So let me just explain. Mm-hmm. Scientifically, there's just not, particularly in terms of, you know, dissemination of information of the impact that organ donation has on people's lives. I think that information and awareness of that and the evidence of that is lacking in certain communities. So that's the scientific argument. Culturally, the idea of taking someone's organs and giving it to someone else is something that is still, you know, potentially could be seen as some kind of a cultural faux pas, whereby they don't necessarily understand the importance of that. And some communities and cultures may just not have that belief. And more so from an existential standpoint, and I apologize for becoming or being philosophical, is that when you look at certain racial ethnic groups that may have certain religious beliefs, that might serve as a potential barrier or facilitator. And it really depends on how it is couched and presented to them in order for them to be able to, one, either enroll in some organ donation program, or would they refer and impress upon their family members and their loved ones to participate in some organ donation program. So, you know, I just laid out those three potential reasons as to why there might be some, you know, consternation or hesitance in enrolling in organ donation programs, especially among underserved communities.
It sort of brings me, Dr. Chung, to an idea. You know, you do these community health clinics, and whether it's in the churches or at the communities, and maybe it's you know, go and vote, get your flu shot, become a donor. You know, maybe these things are, maybe it's your health fair in that regard, where if we keep repeating this message that, you know, God forbid something happened to you, you could help save someone else's life if your religion permits it and your beliefs and faiths in that nature. I mean, maybe you guys are doing that, and I just don't know that because I'm not in your world. So
yeah, I totally agree with that sentiment in terms of people in the community, whether it's for voting or your flu shot, and as well as organ donation. And I think there is a deep-seated mistrust associated with offering to donate one's organs among people of color. And I think it's very much intertwined with the history of these community research and with healthcare. And I think there's consciousness, given the criticalness of the election time and the twin pandemics that we've seen in terms of COVID and the social justice issues, and people wanting to make a difference and wanting to improve our situations in some capacity, and wanting to know what is it that I can do within my domain and my power to impact that, right? And I think that starts with those small acts, right? And it starts with organ donation that can help the life of someone else, or with your vote. And there's tremendous presence with this webinar on social media, and with mobilizing the youth, the Gen Zs, and getting them involved, and just kind of building off of that momentum as well.
Because, you know, for me, it was always you signed your organ card when you got your driver's license. But if people aren't commuting, how is the organ community going to get people to sign up now?
Well, I mean, car buying has gone up because people find that as their only medium of kind of feeling free, so to speak, or just to get places where they don't have to rely on public transportation because of COVID. So I think it depends. There's a lot of things that may create opportunities, and there's a lot of creativity going on in how to have referrals and to engage people and to raise that awareness on so many different levels. There's a huge push on there for people wanting to get involved in many different ways.
Wow. I want to take a second to sort of gather my thoughts and Eugenia, come back to you and sort of, you've been with us all month, and we've covered high blood pressure with Dr. Thomas, and we covered GERD and acid reflux with Dr. Bearson, and Dr. Grander with Peter and Jeannie Stein covered brain function and cognitive function, and Lisa Graham and Teresa Schumart, our awake community educator, covered the diabetes overlap. And obviously our fifth unlucky week, we've got Dr. Chung and Dr. Seixas to sort of help bring it all, encapsulate it, how all the vulnerable populations are affected by all these comorbidities, let alone the twin pandemics, let alone the political climate, let alone our awake model, which used to be in person and behind the clinic doors. That's changed overnight. That's why some of the work we're doing with Dr. Parthasarathi to develop his peer buddies and to scale it nationally, but not just for CPAP education, for diabetes education, for COPD education, for how to manage your heart disease, how to manage your mental health, and get the trusted messengers in each of these communities to be repeating this message, because we know people don't get it the first time, but if you hear it over and over, it's going to start to sink in and start to absorb. And then most importantly, for us as a patient advocacy association, our job is not to save the sleep field. Our job is to take the sleep message to the cardiovascular field, to the dementia field, to the cancer world, to the pediatric world, where we know that this disease and specifically apnea is the end of the road, where we can prevent it and reverse it, as we've seen with my daughter, who unfortunately is the exception right now and not the rule. So, at the end of SLEEPtember 2020, in the middle of COVID-19, and I imagine next SLEEPtember 21, I got a feeling we're still going to be dealing with some sort of COVID-21. It's a scary thought. It's a scary thought for every one of us, for our children, for our education, for the economy, for the political environment. But this isn't magically disappearing overnight without unified leadership like you're seeing in some of these other countries, who are still seeing spikes because of the fatigue and the discipline. So I'm just trying to get my head around this on a daily basis and put one foot in front of another as a layman, and learning how to manage it for myself, my wife, and my child, but also for our community, for our patients, our board members, our awake leaders, and for anybody that's, dropping by our site, sight unseen, going on Google and finding sleepapnea.org and visiting us. I want to make sure that they're getting the right up-to-date information and not just being sold an intervention. That's not our job, is to sell interventions. Our job is to make sure that people get the right intervention at the right time of their journey, no matter what door they walk through. So I sort of like to go around the room and sort of do sort of a final wrap up with you guys. See how long we've been talking here. We've gone about 45 minutes, which is short for me. But sort of just wanted to get we checked in at the beginning. Let's sort of check out at the end and sort of see where we think we'll be in a year. Not that we're all prognostic. I can't even say the word. I've been watching too many sports, so I've been watching the the prediction analytics. So, by the way, before I forget, go Heat. Where do you guys think we are in a year in the sleep field with our community, our vulnerable communities, with COVID, with the urban rural issues, with our geriatrics? Any one of these that you want to touch upon. I know we can't cover it all, but I know some of these are dear and close to each of your hearts. So I'll start with you, Dr. Seixas, and we'll end with Dr. Chung.
Well, I really thank you so much, Adam, for your convictions, especially your family's convictions and commitment to bring the good news to the community. Embody our patient advocacy group. So forecasting where we see things, and I am not going to try and be a little bit clairvoyant, but as scientists at times, we're asked to describe the present and forecast the future so that we can prepare for the future. So I'll describe what the present looks like, and then I'll forecast. So today, we know that there are certain public health strategies that work. Wearing a mask, social distancing has worked. It worked during the Spanish flu. And in fact, we should be cautious because as a scientist, we're a little bit of a historians as well, because it was to my knowledge that the huge numbers that we see in the Spanish flu came about during the second wave. So we have to use that as caution, especially as we deal with COVID. Now, let's forecast a little. And we're seeing some evidence of this, and we're thinking about looking at this in our own research lab as well as with our colleagues. And so my concern is not necessarily people getting COVID. I think that is a huge concern. But we realize, based on just numbers, and I'm not trying to diminish the 200,000 plus people who have passed away, and so my condolences to them and their family and their friends. My big concern are those individuals, I believe 6 million worldwide, if not more, who have gotten COVID, who have, somewhat gotten over it. There has been a new phenotype of individual, what they consider as long haulers, who did not have a pre-existing condition, who, after they have somewhat recovered from COVID, are experiencing very, very extreme changes in their health. They are experiencing very abnormal symptomatology, from inflammation to losing of smell and sight, to just being, out of breath, to having night tremors. It spans the gamut. My big issue is the long-term consequences and health consequences, as well as financial consequences of those long haulers, as well as how they will be treated by the healthcare system, which includes not just providers, but also payers, because COVID will now become a pre-existing condition.
Wow.
And so we have to be very, very, very vigilant and careful about not just saying, yes, of course you could get it, and the percentage of people who get over it is far greater than the people who pass away. However, as scientists, we are working very hard to figure out what are the long-term consequences, both physical and mental health and economic. And so we advise people to try and avoid getting COVID because, one, health-wise, you could put yourself at greater risk for developing some chronic health conditions, as well as some abnormal presentations of disease and maladies, as well as it could hurt your pockets because it could potentially negatively affect your ability to get coverage through some healthcare premium. And so that's where I would like to leave your audience today. Thank you.
I think that you couldn't have said it any better, Dr. Seixas, and I appreciate you putting that all in our thoughts and our minds, especially with what's on the horizon tonight and where we're all at in a month from now. Whoever you want to vote for, just know you're voting not only for your own life, but you're voting for your family and your friends around you. Kevin, I'll go to you in Toronto and sort of just check out and where your head's at and how you doing and what are we going to do, knowing that Dr. Seixas just said that the Spanish flu had the spike. The bigger spike was the second wave. I'm scared to ask what magnification that means. If we lost 200,000 poor souls in the U.S. alone, what that potentially could mean for next year. But that's sort of what's got me choking on my own words right now.
Yeah, and you're right, Adam, and Dr. Seixas did put it so eloquently. It affects many factors here, socioeconomic and healthcare and, coexisting conditions and now, seeing COVID as a pre-existing condition down the line. I think with any shift in healthcare, we were always talking about health prevention, right? And this is basically, when we talk about sleep apnea, prevent all the coexisting conditions that occur when someone has obstructive sleep apnea. So to sort of put it in other terms regarding COVID, and when we talk about people adhering to social distancing, wearing a mask, washing hands, being more, diligent about all these things. When we talk about where we would like to be in a year, that's where I would like to see people being more responsible, taking responsibility for their health care and those around them, and also looking at the preventative measures that they can instill, like, getting checkups, getting vaccinations, seeing your healthcare provider if you are symptomatic, self-isolating, monitoring symptoms, all those things that it can be looked at as preventative care.
I think
so, when we talk about...
I was going to say, Kevin, I think that's a great takeaway for our audience, and that, Dr. Seixas said, everyone needs to worry about, 1, wearing your mask, 2, physical distancing, and 3, you add the most important thing for our community is wear your CPAP mask on as well when you go to sleep, because if you wear that, you're going to have a strong immune system and you're going to have a better chance of managing or fighting off any of these issues that you might be dealing with. And with that being said, I would love to then now go to the one and only Miss Eugena Brooks and sort of get your mindset on where you think we are at the end of this Sleeptember, and what your hopes are and future are for next Sleeptember for our legacy and what we hope to make a difference in our patients' lives.
Well, at the end of this Sleeptember, we are certainly in a place we never dreamed of being when we ended Sleeptember a year ago. Going forward, I think we have our work cut out for us in terms of keeping abreast of what is needed to be done and getting the message out there to the people to be proactive about their health care and their sleep. Sleep is so important. Sleep is life, as they say. Okay, we've got to do that because it impacts so many other things negatively if we don't. And I'm a walking example. Okay, had I had any idea about the time that I took away from getting good rest, had I any idea about what was going wrong, had I any idea about that it could even happen, had I had any idea about the relation between poor sleep, sleep apnea, and the other comorbid issues, if I had any idea, I would have done something about it. It would have made such a huge difference in my life. When I caught a clue, it has made such a huge difference in my life. I am 100% better than I was at the beginning of this journey that is so short because my association with you guys is only 2-3 years long. And my health, believe it or not, is so much better than it was when I met you. And
I'm a witness. I'm a witness to that, Eugenia.
You absolutely are. You absolutely are. I was a hot mess when I walked in down there in DC. Okay, not much better, but I'm somewhat better.
Listen, two years
improving all the time. Okay,
2 years later, you're the voice of our community and writing from your perspective what's going on in your journey. And it's incalculable at this point how many lives you probably saved just by telling your story and by doing what you're doing. So not only you saved your own self life, like they tell you on a plane, put your mask on, but then help those around you. And I think that's the takeaway for next Sleeptember. Let's see how many other people. Let's make it our goal, Eugenia, that we're here next Sleeptember and that we are disciplined and we wear our mask and we do our physical
Absolutely.
distance, because we've got more work to do. And with that being
Absolutely.
said, I would love to leave this with Dr. Chung, who sort of goes at my favorite part of all this in the prevention and the long game and the big picture, and that's the pediatrics. And that's our poor children at home that are stuck at home, or our children that are being forced to go to schools right now that are maybe not in the safest of environments, and they're bringing potentially COVID exposure back. But just where your head's at right now on the little ones who are our future, and are going to be the legacy and the generation that's going to live in the post-COVID world eventually when we do find a vaccine or a way to manage something.
Thank you for that, Adam. And thank you to my colleagues on this panel and all of the great synopsis that you've given thus far. I would say in terms of the children, there's so much, and I myself, so much that we can learn from them, right, in terms of their resilience and how much they're untethered by the world around them, and they just go fearlessly. And I think while communities of color are facing so many challenges and they had historical disadvantage to begin with and were economically depressed, and while these underlying issues are exacerbated during these times, there's a lot of strength. There's strength in these communities, there's strength in the community, and there's strength in our children. And while us as parents, we try and protect them, they haven't been exposed to the negativity in this world as long as we have. So there's so much strength to yet be found from them. And I think it's remarkable in terms of how they persevere through it. And in terms of the children who've been staying home, I think we'll see a lot more of that. And I think microschooling and the school pods that are coming about, I think that's something that will proliferate and what was once something for higher socioeconomic tax sectors or economic levels, that is very much accessible and attuned to all strata, right? And I think in terms of how communities come together and when we leverage that social network that we have, I think we will see more of that. And I think we will see informal networks rely more on each other and find strength in each other. And I think that's really going to be one of the ways that we come out of the situation through the winter into next spring, by next fall. And through that, I think our children will be stronger than us. They will be very resilient. They will persevere. I think some elements, people touched on mental health in terms of separation anxiety that children may be facing. They are very much forgotten in this, with not being able to socialize with their friends or being secluded. It's not normal for them. Like, none of this is normal, right? But you know what? It's preparing them for what's yet to come and giving them the strength and the skill sets for adulthood of what's yet to come. So I think they very much will teach us in so many ways how to get through this.
I think that's a very optimistic and positive way of looking at this insane world that we're living in right now, needlessly, because we know that, our country compared to other countries like Kevin's and others in Europe, there was a way to manage this. And this has been a lot of negligence, on part of leadership and the political part, and places that should have never overlapped. So, the way I look at it is the system's been exposed, but we have a chance now that all the warts and everything has been shown to go actually and fix it so that the children are our future. Yes, they're going to have a skill set that we never had, but so did the 9/11 children, so did the children of Vietnam, so did the children of World War II. Right. And this goes back, history after history. The one thing I can say for my daughter is she's doing great. She's an only child, so she's alone. Is she on the screen too much? Absolutely. I hate it. But it's not a long-term solution for it. But for the next year, I know she'll be okay with it until we figure out what the long-term new life that we're all going to live in this new COVID world. Because honestly, and people need to be realistic, there was never a cure for malaria. There might not ever be a cure for this, and that's reality. And that's going to change, take a change of mindset. So my wish for the next Sleep 2021 is one, that we're all here, we're all healthy, that our community's with us, that the country is not fighting amongst itself, that we're all rowing in the same direction, and that we could start to not only help ourselves and bootstrap ourselves, but help those around us, no matter who you are, no matter what walk of life you're in, because we need each other, and it's not that we want to stand on each other's shoulders, we want to stand side by side. And with that being said, there's just so much pain and so much hatred right now, that, like I said, if you have to look at the positive, it's all on the table now. It's not, nobody's not can deny it. What you believe in and what your education is a different story. So coming back to what the great folks and the doctors at NYU have taught us is, it's about the trusted messengers. And our hope is for next SLEEPtember that our audience continues to grow organically, and that people know that when they come to our site and they come to our channels and they participate in our programs or our research projects, that they know that we're doing this for the right reasons and we're trying to find better outcomes for all of us. And speaking of the future, look at who's in Dr. Chung's lap. That's the future. Hello there.
Hi.
You say hi?
No.
It's okay.
Adam, if I can just say something, since you
Please.
paid homage to myself and Dr. Chung, and I know Dr. Chung would say this. I think we follow the lead of the community. The community in many ways, and Miss Brooks is one person who has led in many ways. We follow the community, and if there's something that we can learn, is that, and it's not just in Europe actually, Adam. If you look at the Caribbean, certain places in Latin America, and Africa, their rates have not spiked. And this has nothing to do with seasonality. I know some people were saying in Africa they weren't experiencing their winter, so when they experience their winter. But what we've seen overwhelmingly, my colleague, Dr. Judith Blanc and Jordan Jean-Louis, they just put out a piece looking and showing how in Haiti and in other low to middle income countries, we have a paper in press right now looking at that and laying out what we can learn. So this idea of community for the greater public health good could facilitate people, adhering to many of these public health mitigation strategies, and it's something that we can point to as a potential silver lining, that we're all in this together, and that's the only way we can get through COVID. Not even the vaccine, because in order for the vaccine to work, we need to develop herd immunity. Everyone has to participate. So just want to underscore that, and just say that the true heroes and stars are the people who we serve in the communities.
I think, Dr. Seixas, that's let's go out on that. But to know that there is a silver lining that's going on outside the borders of the U.S., especially in some of these smaller Caribbean countries or Latin American countries, or even in Africa, that's encouraging. I know some of the countries in Asia have got it down right. So I know we can fix a lot of this and learn how to manage it. I just, for us and for the sake of humanity, I can't wait till we're all rowing in the same direction. Because right now we're making it really hard on ourselves in this country, and it's needless, it's negligent, and it's not acceptable for me and for my child and for anybody that I care about, and which is everyone. And this is more important than all of us. If everyone could wave and smile until next year. I'll see you in SLEEPtember 21, but I'm sure we will have many more monthly check-ins along the way. Thank you all. Thank you, Eugenia. Thank you, Kevin. Thank you, Alicia. Thank you, Azizi. One love, and get some sleep. Thank you.
Take care. Thank you so much.
Bye, all.
Adam's awesome.